Okay, okay. So yes, we can start the session now. Okay, so you can just write your doubts in this message box so that I can be able to solve this. If anything related to it, lecture you're not able to understand, then please let me know. Okay. Yeah, so everything is fine. Okay, okay. So yes. Yeah. Okay, so till now we have covered up the general anatomy, anatomical terms, planes. We have covered up the skin. We have covered up the fascias. We have covered up the deep fascias and modifications of deep fascia. Yeah, hello, good evening, dear. So now today is a very important topic which my dear student has to know, that is the skeleton system. Actually, why skeleton system is very important? Because if you have got a proper understanding of skeleton system, then it becomes easy for you to understand the joints. And joints is again a very important topic, because when I will cover up the gross anatomy, then also you have to be solving the joints related question. That is highly important for you. Okay. So yes, everyone, I am audible. Okay. So my dear students, the joints topic. So before coming up with the joints and the muscle topic in general anatomy, I would like to cover the skeleton system. Okay. So skeleton system, what all things you have to know? So to firstly start with the list of bones which is included as appendicular or axial skeleton. So first is that, let me just show you this image. In this image, you can see there is two images shown to you. One is showing you all the bones in the midline of the body, and the bones lying in the midline of the body is called as axial skeleton, and the bones which is lying, the bones mainly of the upper limb and lower limbs are called as appendicular skeleton. So that means skull, the vertebral column, the rib cage, the sternum, the facial bones, all these bones are included in the list of axial skeleton. And the bones of upper and lower limb, that is humerus, tibia, radius, ulna, femur, tibia, fibula. So many bones are there, and hip bones, all these bones, shoulder bones, scapula and all these bones are included in the list of appendicular skeleton. It's also important for you to know the list of bones where it is residing. So that is very important. So please write down what is axial skeleton and which bones are lying in the list of axial skeleton. So if I just tell you about the total of bones which is included in the axial skeleton, we have got 80 bones in the axial skeleton. So these bones are lying in the central axis of the body. So where it lies, these bones lies in the central axis of body. And the important point about these bones are that they help us to stand erect. So basically they are responsible for erect posture. These bones are responsible for us to stand erect. So they are maintaining the erect upright position. So responsible for upright erect posture. Got it? Now, total how many bones in our body is considered to be the axial skeleton bones? So total axial skeleton bones are 80 in number. So we have got 80 bones in total, which is considered to be the bone lying in the central axis of the body. And the important bones which is included in this list are the skull bones, vertebrae, the ribs and the sternum. So all these bones are called as the axial skeleton bones. Okay, the bones which is lying in the central axis of the body, responsible for upright position. Now coming to the next list, that is appendicular skeleton. So when I talk about appendicular skeleton, these bones are paired, and these bones are the bones of limbs. So they are actually the bones which is lying in the superior and inferior extremity of the bodies. So paired bones. They are paired bones of limbs, and they are the bones mainly of superior and inferior extremities. Now, they are actually important bones which help us in locomotion. What is the function of, for example, the bones which is of the femur, tibia, fibula, all these bones which are of the limbs, they are helping in locomotion. locomotion and grasping. And we have got a total of 126 bone approximately, which is considered to be the bone of appendicular skeleton. So basically this makes a total of 206 bones in our body. Actually that number of bones is also according to the age. So basically if we talk about the children's, they have got their ossification not completed. Okay, still ossification is not completed. So basically if the ossification is completed, then in adult bones we have got a total of 126 appendicular and 80 we have got axial bones. Otherwise in children's we have got more number of bones, because epiphysis and diaphysis of all the bones has not fused yet. So that is the reason. Now actually in today's session the topic is skeleton system, general anatomy, which we are going to talk. So in that case I would also like everybody to know about firstly I would like everyone to know about cartilage. That is very important. So it's very important that we should also talk about the cartilage first, and then we should come in the list of bones. Okay, so let's see the firstly I would like everybody to know about the features of cartilage. Okay, so let's write it, features of cartilage. Now, if I talk about cartilage, actually what happens when we are talking about enchondral ossification also, firstly the cartilage model is formed and then the bone is formed. Okay, after that the bones are formed. So that is important for you to know. So if I talk about avascular features, if I talk about the features of cartilage, they are avascular structure. So they are not having blood supply of its own, they are avascular, they are having no lymphatics, okay. So they are having no lymphatics and they are having no nerve supply of their own. They have got low metabolic rates. Growth, they have got low metabolic rate, and the growth which happens to take place in the bones are of interstitial and appositional growth. Okay, so they have got the growth which is happening both in the length and both in the width. So the bones are going in the width and also in the length. So these kind of growth is called as interstitial or oppositional growth. Now, they are highly resistant structure, having tension, compression and shearing force, also having elasticity. So we will talk about the varieties of cartilage in our body, because in general anatomy, cartilage is a very important topic. Not only this, if I am talking about the histology session, I will also tell you that in general histology topic, the cartilage is a very important topic, and we have got various types of cartilage in our body. We have got hyaline cartilage, which is again of costal and articular variety. We have got fibro and we have got elastic cartilage. So each of this variety and how they appear, it has to be known to you. Okay. So when I am talking about interstitial growth, it means the length of the bone increases. So that is, growth is internal from inside, and the chondrocyte cells of the cartilage all growth, and exactly the growth occurs in increase of length. When I am talking about oppositional growth, external outside growth is from the perichondrium and the cells, and the increase of width of cartilage is called as oppositional growth. So that is an important thing which you have to understand. That is an important point. So I will also tell you about, I will write this interstitial and oppositional growth. Through be memorizing the important features, you should know that cartilage is a avascular structure having no lymphatics of its own. It is having no nerve supply of its own, low metabolic rate. They have got low metabolic rate. Growth is happening both interstitial, oppositional, highly tensile structure, and having more of resilience and elasticity. Now, further elaborating the features of cartilage, cartilage is covered by dense connective tissue sheath and outer covering that is called as perichondrium. Okay, perichondrium, like in bones we have got an outer covering of periosteum. In cartilage we have got an outer covering of perichondrium, except the perichondrium is absent. So basically we know that cartilages are of various variety. Cartilage is of hyaline variety, which is again of costal and articular variety. Cartilage is of elastic variety, and cartilage is of fibrocartilage type. So if I am talking about fibrocartilage and articular cartilage, there is no presence of perichondrium. There is absence of perichondrium. If I talk about perichondrium, the perichondrium layer is consist of an outer layer and inner layer. The outer layer of perichondrium is called as outer vascular or fibrous layer, and the inner layer is chondrogenic layer, which is made of cells. So they are cellular layer. Okay, dear students, if any students is not understanding anything, they can ask me. Okay. All of you, please let me know if you're not understanding anything or you want me to repeat it. So please let me know. Okay. So what is the outermost covering? Perichondrium. Perichondrium is made of two layers, outer fibrous vascular layer and inner chondrogenic cellular layer. Okay. So basically, before coming into the features of individual, I would like everybody to know what do you mean by interstitial and appositional growth. So two types of growth I have mentioned in the cartilage. One is interstitial growth, which is internal or growth from inside. That is growth happening from inside growth. So here chondrocytes, as we know, the cells of cartilage is called as chondrocytes. So these are the cells of cartilage. Secretion of more cells of cartilage, and due to the secretion of more cells in cartilage, it leads to growth in the length. So causes, if I am talking about the interstitial growth, it means it is causing the growth in length, causes increase in length. What about the appositional growth? So if I talk about oppositional growth, the oppositional growth is called as external, or the growth which is happening from outside. Okay, here what happens, the perichondrium is there, that is an outer covering, and these will generate. So if I am talking about the perichondrium, it is having chondrogenic layers and the cells are cells are formed, and these are increasing. This type of growth is increasing width of cartilage. So that means both in the cartilage there is increase in length, interstitial growth, and there is oppositional growth. Now what is important for us is to know, so I would like to tell you about individual variety of cartilages. So broadly the cartilages are of how many types? Broadly the cartilages of 3 types. So that is very, very important. So I just want you to write this. Please write down. If I am talking about cartilage, so this is important that you should be aware of classification. So if I am talking about cartilage, which all cartilage features you have to know. So cartilage. So if I'm talking about cartilage, the cartilage can be categorized into following types. So broadly the cartilage is of how many variety? 3 types. They are hyaline cartilage, elastic cartilage, fibrocartilage. Okay, so these are 3 varieties of cartilage: hyaline, elastic, and fibrocartilage. Here, hyaline cartilage, if I am talking about hyaline cartilage, it again divides into 2 cartilage. So we have got here elastic cartilage, and in this hyaline cartilage it is divided into 2 varieties. One is articular and the other is costal variety of cartilage. Okay, many times students get confused. So many times what happens, students get confused and they feel that hyaline cartilage is only the costal variety. No, hyaline cartilage is again divided into 2 varieties. Hyaline cartilage is again divided into 2 varieties. One is articular and the other is costal variety. Altogether, the cartilage can be categorized as 3 varieties: hyaline, elastic, and fibrocartilage. Okay, now moving on to the each variety. So I would like to explain the each variety, and I would like to so basically I would like to first explain the general aspect or general anatomy related to the cartilage, and I would like to show you few images, histological images. Actually today's class is for the general aspect or general anatomy related to cartilage and bone, but I would also like to give you few important features of identification of the slides of hyaline, elastic, and fibrocartilage. Okay, so let's See this. So if I talk about hyaline cartilage, if I'm talking about hyaline cartilage, till now my students are understanding. Okay, so if I'm talking about hyaline cartilage, it is again categorized as the costal and articular variety. In the costal variety, we have got type 2 collagen fibers. Actually, whenever I am using the word cartilage, okay, that means cartilage is composed of type 2 variety of collagen fibers. That is common to each of the variety of cartilage. But if I am talking about fibrocartilage, that is the odd man out, and it is having type 1 variety of collagen fibers. Okay, so if I am talking about costal varieties, and articular variety, both is having type 2 collagen fibers. But an important point which is important for MCQ, so I just want everybody to pay attention to this point. Then when I am talking about the articular cartilage, there is absence of perichondrium, but in the costal variety of the hyaline cartilage, there is presence of perichondrium. Perichondrium, which is made of 2 layers, that is an outer chondrogenic and inner cellular layer. So there is absence of perichondrium in the costal variety. There is absence of perichondrium in the articular variety of hyaline cartilage, but there is presence of perichondrium in the costal variety of hyaline cartilage. Got it? Now it is also important for us to know the examples of hyaline cartilage. So hyaline cartilage is present at several locations, and it is important that you should be knowing all the examples of hyaline cartilage which is present in our body. The important location where we have got hyaline cartilage, so it is present in the articular variety. So that kind of cartilage is articular cartilage. So articular cartilage is actually made of hyaline variety of cartilage, except at the location of TM joint, sternoclavicular, acromioclavicular joint. These are the location where we have got atypical features. When I am using the term atypical, what do you mean? Generally, the articular cartilage is made of articular hyaline cartilage type, but at the location of temporomandibular joint, sternoclavicular joint, and acromioclavicular joint, it is made of fibrocartilage. Very important point. The other example is costal cartilage, which is obviously known to you, respiratory tube. Okay, when you see the cut section, you must have appreciated there is in trachea we have got C-shaped hyaline rings, hyaline tracheal rings, which is made of hyaline cartilage. Also the principal bronchus. So if I am using the word respiratory tube, that means which all structures are definitely having this kind of hyaline cartilage. So basically, in case of respiratory tube, we have got mainly the hyaline cartilage is present in, so you have to note down, it is present in trachea and it is present in principal bronchus. Okay, now it is also present in growth plate and it is also present in fetal cartilage. So all these which I have written is the example of hyaline cartilage. So many times the MCQ comes for your university paper also, or an enumeration question in which you have to write the examples of hyaline cartilage present in our body. We have to know different types of cartilage, the characteristic features of the identification of these cartilages. For that I will also include the histological diagram. Now let's move on to the one more diagram. So here actually elastic cartilage. Now I would like to talk about elastic cartilage. So when I'm talking about elastic cartilage, more of elasticity is there and perichondrium is present. In hyaline cartilage also we have got the presence of perichondrium. Only the articular variety of hyaline cartilage is having absence of perichondrium. Okay, elastic cartilage is also having perichondrium present, and the collagen fibers are of type 2 variety. Examples of elastic cartilage. So it is present in external ear, eustachian tube and epiglottis. So what is epiglottis? Epiglottis, corniculate and cuneiform cartilage. So basically, and tip of arytenoid cartilage. Actually, one more important thing is here, which is important to mention here. For example, here you can see I have written in the respiratory tube, nasal cartilage, thyroid, cricoid, arytenoid, except the tip is made of hyaline cartilage. So arytenoid is a cartilage. Actually, these are laryngeal cartilage. So we have got 9 laryngeal cartilage. How many? We have got 3 paired and 3 unpaired laryngeal cartilages. In this overall laryngeal cartilage, the thyroid, cricoid and arytenoid, except the tip, is made of hyaline cartilage. Tip of arytenoid, the epiglottis, the corniculate and the cuneiform part of the cartilage, laryngeal cartilage, is made of elastic cartilage. So that is an important point for you to note down. So example of elastic cartilage, perichondrium is present, type 2 collagen fibers are present, and the elastic cartilage is present at the location of Eustachian tube. What is the other name of Eustachian tube? Eustachian tube is also called as auditory tube. It is also called as auditory tube. It is also present in epiglottis, the leaf-like cartilage which is attached to the posterior aspect of the tongue. It is also present in tip of nose, tip of arytenoid, corniculate cartilage and cuneiform cartilage. Now, it is also important for your examination and for your MCQs that you should be aware of other name of corniculate and cuneiform cartilage. These are small paired cartilages of larynx. So, cuneiform cartilage is also called as the cartilage, Vrisberg cartilage, and corniculate cartilage is also called as Santroni cartilage. Okay, so this is important for you to know. So Vrisberg cartilage. So the other name of cuneiform cartilage is Vrisberg, and the other name of corniculate cartilage is Santroni. This is important for you to note down. Okay. Now coming to fibrocartilage. The third category of cartilage is fibrocartilage. Okay. Fibrocartilage has got certain features which is distinct from other. So when I am talking about fibrocartilage, there is actually the collagen fibers which is present in fibrocartilage is type 1 collagen fibers. Till now, we have seen the hyaline cartilage, we have seen the articular cartilage, costal variety. We have seen the hyaline cartilage, costal variety and articular variety and elastic cartilage. All these cartilages were having type 2 collagen fibers, but fibrocartilage is having type 1 collagen fibers and the perichondrium is absent. Okay. The example where we have got fibrocartilage is the intervertebral disc. What is intervertebral disc? The intervertebral disc is present in between the vertebral bodies, in the pubic symphysis, in the knee meniscus, that is medial and lateral meniscus, which is also called as seminular cartilages. So the example where we have got the presence of fibrocartilage is intervertebral disc, articular disc, knee meniscus, glenoid labrum, acetabular labrum and pubic symphysis. All these structures which has been mentioned here are the example of fibrocartilage. Fibrocartilage is having no perichondrium, outer covering no, and it is having type 1 collagen fibers, not type 2 collagen fiber. This is important. These points which I have mentioned along with examples are very, very important for you to understand, because these is number of times, these kind of questions are number of times repeated in examination. Enumeration question also come about the type of cartilages along with this examples. Okay, till now any doubt, my dear student? Okay, any doubt, then you can let me know. Now coming to developmental of cartilage. So cartilage is formed from the mesenchymal cells, and from the developing undifferentiated mesenchymal cells, chondroblast, the primitive cells of the cartilage is formed. This is devoid of matrix, but when it gets mature, matrix is formed, osteoid matrix is formed, it becomes mature chondrocytes. Okay, this is how the cartilage develops. Now, type of cartilage, as I have told you, three types of cartilage are there: hyaline, elastic and fibrocartilage. Now I want my dear students to also mention and see few images. So which images I am showing you? Okay, the images which I am showing you is the histological images which will help you to understand the type of cartilage. Okay, so see here. The first cartilage which I want everybody to understand is hyaline cartilage. When you see the slide of hyaline cartilage, basophilic appearance will be there. Okay, it will be slightly bluish, homogeneous basophilic appearance is there. And hyaline cartilage, as I told you, it is found at the ends of bone. Articular variety is found in trachea, in which it is found in the trachea and in the laryngeal cartilage, that is thyroid, cricoid and the arytenoid, except the tip. Blue white color, strong, rubbery and a very flexible tissue. Important features of hyaline cartilage is that when you will see the cells of hyaline cartilage, that is costal variety, actually the cells are called as chondrocytes. Now these chondrocytes appears in group. Okay, so these chondrocytes which I am talking is appearing in the group. So these chondrocytes appears in the group, and they are actually, for example, if you, I am just enlarging this image. So everyone please concentrate on this image. So So I am giving you a view where you can see the high power view of hyaline cartilage human trachea, and what you can appreciate here that this are chondrocytes. So what you can see, groups of chondrocytes are there. So generally groups of chondrocytes are there. Here also we can see the groups. So generally there are groups of chondrocytes. So it means that they have got isogenic group of chondrocytes. Chondrocytes are generally not distributed singly, but they are in the group. So these, and a whole appearance of the slide will be bluish in color, homogeneous basophilic appearance. Okay. So here I would also like to show you another image. So basically this is a slide of hyaline cartilage. So for better understanding, I just want to enlarge it. So when I enlarge here, you can see the hyaline cartilage. Here, the important points which you have to pay attention is, okay, so see here, this is isogenic group of cells. So can you see all the chondrocytes which you are seeing? The chondrocytes are mainly in the groups. Okay, so these chondrocytes are mainly in the group. This chondrocytes which is in the group is called as isogenic group of chondrocytes. So what are they? They are called as isogenic group of chondrocytes. They are called as isogenic group of chondrocytes. Isogenic group of chondrocytes. They are called as isogenic group of chondrocytes. Other than that, in the outer aspect, you can see this is the layer of perichondrium. So what is this? This is perichondrium. This is perichondrium. Now this part is the fibrous layer. So this part is the fibrous layer of the perichondrium. This is the fibrous layer of perichondrium. This is the fibrous layer of perichondrium which you are seeing. Okay, this is the fibrous layer of perichondrium which you are seeing. And this is the chondrogenic layer. What is it? This is the chondrogenic layer. This is chondrogenic layer of perichondrium. So that means when you get a slide in which you can see the appearance is bluish, slightly bluish, homogeneous basophilic appearance with the cells in the groups. Chondrocytes are more in number but are residing in isogenic groups. I can help you to understand, like the students are, chondrocytes are students, and these students are going for a group study. They are having a group study. So they are, what they are doing? They are doing group study. Yes, good evening dear. So they are going for group studies, and the matrix which is surrounding the chondrocytes are darker in shade. So they are called as territorial matrix. The matrix which is lying outside the chondrocyte, so this matrix are called as territorial matrix. So this is the territorial matrix. So this is territorial matrix. And the other matrix which is lying in between these are interterritorial matrix. These are interterritorial matrix. Okay, they are interterritorial matrix. Okay, now I would like to show one more image here where you can see again. Okay, so again I would like to show. So actually there is again one more slide. So actually I will show you multiple slides in which you can see the isogenic groups. These are all isogenic groups. These are all isogenic groups of the chondrocytes. Perichondrium is there, and you can see the perichondrium, F for the fibrous layer of perichondrium, and C for the chondrogenic layer, which give rise to the immature chondroblast. When this immature chondroblast is surrounded by osteoid matrix, they become mature chondrocytes, and these mature chondrocytes lies in groups that is called as isogenic groups. And the matrix around this isogenic group of chondrocytes are darker stain as compared to the interterritorial matrix. So these are called as territorial matrix. Now, Okay, so dense connective tissue is called as the perichondrium, which is surrounding, except, so basically perichondrium is present in the hyaline cartilage costal variety, but perichondrium is absent in the variety of the articular variety, and it contains blood vessel, nerves, lymphatic. It also contains collagen fibers and fibroblast. Okay. Okay, dear students. Now, one more image. So I would like to show you multiple images. This is the image which is basically showing you the slide of hyaline cartilage, in which you can appreciate all the features. So we can see here the layers, which is fibroblast layer of the perichondrium has been seen. Perichondrium outer layer is, so I just want to enlarge this image so that you can get a better idea. See here. So when I enlarge it, you can get a better idea of the image. See here. Is it okay? Yeah. So what you can see in this diagram, that the fibrous layer is having fibroblast of the perichondrium. Then we have the inner layer that is called as chondrogenic layer of the perichondrium. The same thing which I have told you. Other than that, we have also surrounding blood vessels and connective tissues. We have got isogenic groups of the chondrocyte, which is lying in the space. The space where this group of chondrocytes lies or reside, the chondrocytes where it resides. So that space is called as what? That space is called as lacunae. Okay. That space is called as lacunae. Okay. Now, the matrix, if you will see around the chondrocytes, are darker stain, so they are called as territorial matrix, and the matrix which is lying in between is interterritorial matrix. Also there will be associated tracheal glands and all. Actually this slide is showing you hyaline cartilage which is present in trachea. We know that trachea is having C-shaped hyaline cartilage which is posteriorly connected by smooth muscles fibers, which is called as trachealis. So the trachea is made of C-shaped hyaline cartilage. So this is the hyaline cartilage section from that level. Hyaline cartilage, here we can see the enlarged image. You can see the high power view, and in this high power view we can see the chondrocytes in large in a larger image, where the nuclei of chondrocytes are also visible. The space where the chondrocytes, the mature cells of the cartilage, that is called as chondrocytes, is residing in the space called as lacunae, and the darker stain matrix is called as territorial and interterritorial matrix. So in this image you can appreciate all these features which I have shown you in the low power view also. Now again, I would like everybody to note down the type of hyaline cartilage. Actually, we are already knowing the type of hyaline cartilage, and I have told you that if I am talking about type of hyaline cartilage, we have got two types of hyaline cartilage, the articular and costal variety. So I just want you to note down the features in which you can differentiate the features of costal and articular variety. So please write on the heading. Okay, so one side you can write costal cartilage, that means costal variety of hyaline cartilage, and other side write down articular cartilage. Articular cartilage means articular variety of hyaline cartilage. Costal cartilage means costal variety of hyaline cartilage. Now, so first point is, which I want you to know, perichondrium. So perichondrium is plus sign, that is positive, and perichondrium is negative. So perichondrium is negative. So the first point is about perichondrium. So perichondrium is not present in articular variety of hyaline cartilage, but it is present in costal variety of hyaline cartilage. Now, other than that, we can say the cells, if I am talking about the cells and lacunae, cells means the cartilage cells, and the space that is called as lacunae in which they reside is present in both varieties. So it is present in articular cartilage also, and it is present in the costal variety of cartilage also. It is present in articular variety also, costal variety also. Now the cells are, if I talk about costal variety, the cells are scattered. They are scattered over in the slide, and they increase in center. They increase in the center. So that means size of these chondrocytes increases when we move in the center part of the cut section or in the histological slide. the cells are, so basically the cells, if I talk about the arrangement of the cells, they are not scattered. In articular cartilage, the cells are arranged symmetrically. In a symmetric way. So the cells are arranged symmetrically. Symmetric. Okay. So if we talk about the collagen fibers are there, they are more arranged in a systematic manner, and also there is zone of arrangement. So actually they are arranged in zones. Okay. So if we see the arrangement of cells in articular cartilage, it is in the form of zone. So there is zone 1, there is zone 2, there is zone 3, there is zone 4. Such zonal arrangement is not there in the costal variety. So zone 1 is actually having the arrangement that is called as either tangential or horizontal. The arrangement of the cells are in the horizontal pattern or tangential pattern, in tangential pattern, and in the intermediate part we have got transitional pattern. In the intermediate part. Okay, in the intermediate part. Other than that, if I am talking of zone 3, it is vertical arrangement, that is called radiate pattern, and the zone 4 is showing calcification, so it is calcified. So basically if we are talking about zone, so basically zone 3 is oblique, more of oblique, and we can say more of oblique. Zone 4 is vertical, calcified. So you can see, if I am talking about the arrangement are in the form of, we have got two varieties, the articular and costal variety of cartilage. The arrangement of the articular variety you can see is in the pattern zone 1, zone 2. So these are all what zones, what I have written here, these are all zones. This is zone 1, this is zone 2, and this is zone 4. Okay, again if I talk about so this is an important point. Again, if I talk about important function which it takes place, so basically it helps in movement of ribs. So basically if I am talking about costal cartilage, it helps in movement of ribs. Okay, if I talk about, so if I talk about the other variety, that is our articular cartilage, it is present at the ends of the bone. So it is present at the articular ends of the bones, and they allow movement and prevent friction. So basically they is allowing movement and prevent friction between the bones. So articular cartilage is present in the articular ends of the bones, and the costal variety is present in the ribs. Where it is present? It is present in the ends of rib. It is present in the ends of rib. And they are present in between the bones, where the bones are articulating. So these are the principal difference which is seen in the two varieties of cartilages, that is the articular and costal variety of hyaline cartilage. Next, we have to know about the elastic cartilage. Before that, I would like to show you an image. So I have already shown you multiple images of hyaline cartilage. Which variety? Costal variety. Okay, so I have already shown you multiple images showing the costal variety of the hyaline cartilage. This is articular variety. So you can see here tangential, transitional, radial, calcified. Then the bone is there. So what you can see, zonal arrangement is there. So in articular cartilage, there is no perichondrium, and zone arrangement, zonal arrangement. So zones are there from first to fourth, zones are there, which I have already written how it is arranged. That is already written, zone 1, zone 2, and zone 3, which we have already done. Okay, cells are arranged in the forms of zone. Now, no perichondrium. Now coming to the next variety, that is elastic cartilage. So I have already told you we will talk about the next variety, that is the elastic cartilage. So when I am talking about elastic cartilage, it is having more of elastic fibers, And actually, if I'm talking about elastic cartilage, it is also having the presence of perichondrium. So I'm just enlarging this image. And when I enlarge this image, if you will see, when I'm enlarging this image, what you can see, there is presence of perichondrium as shown. There is presence of perichondria. The outer is the fibrosite or fibrous layer of the perichondrium. Then we have got the chondrogenic layer of perichondrium, which is showing small chondrocytes. So you can see in the chondrocytes, these are small chondrocytes. These are small chondrocytes. These are small chondrocytes. In between, you can see what are these? These are elastic fibers. These are elastic fibers. These are chondrocytes. So chondrocytes are residing in the space called lacunae, and nuclei of chondrocytes is also there, and the elastic fibers are running. Perichondrium is present. Also, it is brightly stained, and it is actually also important for you to know that it is densely packed. If I talk about elastic cartilage, it is densely packed with the chondrocyte. Large number of densely packed chondrocytes are found in elastic cartilage. Okay, now seeing this next image. Okay. So if we see the next image, it is again of elastic cartilage, in which we can see the outer perichondrium layer. We can also see the elastic fibers, so many numbers of elastic fibers. So you can see here, I just want to use an bright colored. So here you can see these are all elastic fibers. Singly, elastic fibers run singly and in a branching pattern. So all these are elastic fibers. All these are elastic fibers. So all these are elastic fibers as shown. Okay, all these are elastic fibers. Okay, so there are so many elastic fibers. There is chondrocytes residing in the lacunae. This is the matrix. And also there is large number and dense quantity of chondrocytes. And these elastic cartilage will be present at the area of elasticity, like it is present in the epiglottis, it is present in corniculate and cuneiform cartilage, it will be present at the tip of nose, it will be present at the tip of arytenoid cartilage in the eustachian tube. So basically, the third variety of cartilage is the fibrocartilage. Now moving on to the third variety of cartilage, which is called as the fibrocartilage. In the fibrocartilage, we have got a feathery appearance. Collagen fibers is arranged. So fibrocartilage is devoid of fibrocartilage. If I talk about fibrocartilage, it is devoid of perichondrium. And rows of chondrocytes are there, rows of chondrocytes, and nuclei is also seen, collagen fibers, and the appearance of the collagen. So basically, if I talk about all other elastic, articular, or the hyaline costal variety, all the cartilage we have talked is having type 2 collagen fibers. Only fibrocartilage is having type 1 collagen fibers. And if you will see, you can see less number of chondrocytes are there. Less number of chondrocytes as compared to elastic and hyaline variety. Now this is a slide, how it looks under the microscope. So there is no perichondrium, absence of perichondrium. These feathery appearance, these are all what? These are all collagen fibers, giving a feathery appearance, and these small structure with the nuclei in the center. What are these structures? These are all chondrocytes. What are these? These are all chondrocytes. These are all chondrocytes. So you can appreciate the number of chondrocytes are less in number as compared to that of elastic and hyaline variety. Okay. Done? Okay. Now one more diagram where you can see the chondrocytes of the fibrocartilage. These are all chondrocytes of fibrocartilage, less in number. Fibrous matrix having more of collagen fibers, which is present in intervertebral disc, knee meniscus, semilunar cartilages, glenoid acetabular labrum. Now we have done with the cartilage, and this is an important topic, so I have explained it. It will be explained in much more detail when we will when I will took the class of general histology. Now coming to bone. So our next important thing which we have to understand today is the bone. So I would like to describe the important features of long bone. So important parts of long bone. So when I am talking about long bone, a young long bone, so basically I want you to know the features of young long bones. So the features of young long bones are following. What does it contain? So it is having a middle part that is called as shaft. That part of the long bone is called diaphysis. So it is having a part that is called as shaft. So shaft is also called as diaphysis part of long bone. The long bone is having ends which is called as epiphysis. The long bone is also having epiphyseal cartilage. The long bone is also having, so basically epiphyseal cartilage and also epiphyseal end of shaft. So it is also having epiphyseal end of shaft, which is called as metaphysis. It is also having inner endosteum. It is having an outer perosteum. It is having a marrow cavity inside the diaphysis. It is having marrow cavity inside the compact part of the bone, that is in diaphysis part of the bone. Okay, so these are the parts of long bone. These are all the parts of long bone. So what I have written, these are all the parts of long bone. Okay? Okay. Further, I would like to show you an image. Okay. So further, I want you to show you an image where you can appreciate the parts of long bones. So in this image, you can appreciate the parts of long bones. Okay. So here, actually, this is a schematic diagram to make you understand. So these are the long bone ends. So what I told you, ends of long bones are called as epiphysis. Okay. Then we will also have epiphyseal. So we will also have the middle part. This middle part of the shaft is called as diaphysis. So this is called as diaphysis part. This is called as shaft of long bone, which is called as diaphysis. We will also have the metaphysis, epiphyseal end of diaphysis. This is called as the metaphysis, which is the most vascular part of the. So this is the most vascular part of the long bone. It is called as epiphyseal end of shaft. And epiphyseal end of shaft is called as metaphysis. Okay, so this is also metaphysis. Okay. Now, also you have to know the epiphyseal cartilage plate which is seen here. So we will also see the epiphyseal cartilage plate. This is epiphyseal cartilage plate. Okay. So here we have seen and we have written all the parts of developing long bone. So these are all the parts of developing long bone. Now coming to the types of epiphysis. Now what is important, and it comes as a short notes. It comes as a short note first year MBBS students, also it comes for enumeration question, also it comes for MCQ types of epiphysis with examples. So that concept must be known to you. So basically we have got 4 types of epiphysis. So basically we are having 4 types of epiphysis. 4 types of epiphysis. What are they? So we have got total 4 types of epiphysis. They are pressure epiphysis, we have got pressure epiphysis, we have got traction epiphysis, we have got atavistic epiphysis, and we have got aberrant epiphysis. So these are 4 types of epiphysis. You have to understand the variety and you have to understand the example of each variety. Okay, my dear students, any doubt you can ask me. Okay, Sakshi, Sunil, so everyone, any doubt if you are having, you can ask me. So these are the 4 types of epiphysis. We have to understand the concept of epiphysis. We have to understand the example of each variety of epiphysis. So let's see this another image where we can see the types of epiphysis. So we have got 4 types of epiphysis. As you can see here in this diagram, we have got traction epiphysis, we have got pressure epiphysis, we have got aberrant epiphysis, and we have got atavistic epiphysis. So these are 4 varieties of epiphysis which we have to understand: aberrant, pressure, traction, and atavistic. All. So basically I would like to firstly let you understand the types. Okay, so basically we have got a pressure epiphysis, traction, atavistic, and aberrant. So the concept of pressure epiphysis is that, and what do you mean by pressure epiphysis? So pressure epiphysis is present at the ends of the bone, which is articulating ends of the bone. What do you mean by articulating ends of the bone? Means such parts of the bones which is lying at the end take part in the joint formation. So these epiphyses are involved in joint formation. They are involved in weight transmission. So the example, for example, head of femur, head of humerus, condyles of femur, condyles of humerus, condyles of tibia. So whichever part of the long bone which take part in the formation of joint complex and weight transmission are the example of pressure epiphysis. Means the maximum pressure is taken by the pressure epiphysis. Okay, for you can imagine like there is a family in which the head of the family is the pressure epiphysis. Generally father is the head of the family, or it can be either way. So when father is the head of the family, he is taking maximum pressure on him and is maximum responsible for the overall weight, or you can say overall consideration of the family and the needs. So he or she is the pressure epiphysis. Okay, whichever is the family head. The other one is there is father and mother. So always it can't be either one person is whole involved in taking the pressure of the family. So there is a supporting hand also. So that supporting epiphysis is traction epiphysis. So traction epiphysis is the part of epiphysis which is located, is such kind of epiphysis which is located close to the pressure epiphysis at the ends of the bone, but they are not taking part in joint complex. They are giving attachment to, so they are present at the ends of the bone. They are non-articular, they are not involved in weight transmission, but they are actually developing in the line of muscle pull, and they are non-articular parts of the bone, but they are lying very close to the pressure epiphysis. That means traction epiphysis is also helping in the stability of pressure epiphysis, but they are not taking the whole weight transmission or formation of joint complex. So that means close to the head of femur, close to the head of humerus, close to the condyles, we will have the presence of traction epiphysis. So in this diagram, for example, this is the head of the femur. So this is the head of the femur. So this becomes an example of pressure epiphysis. Okay. Here This is head of the femur. These are condyles, medial and lateral condyles. So these are all example of pressure epiphysis. But lateral epicondyle, medial epicondyle, this becomes an example of traction epiphysis. Same goes here. We will have the lesser trochanter, the greater trochanter. So these trochanters, these tubercles, these are all example of traction epiphysis. So here also medial epicondyle, lateral condyle, these becomes an example of pressure. But if we are talking of epicondyles, they are example of traction epiphysis. So that here epicondyles, they are example of traction epiphysis. So these are the important things which you have to definitely understand. So now let's here also one more diagram is there where you can see we have got greater and lesser tubercle of humerus. So greater and lesser tubercles again become the example of traction epiphysis. The epicondyles, medial epicondyle, lateral epicondyles becomes an example of traction, but the condyles or the capitulum, all these will become the example, or head of humerus, these all become the example of pressure epiphysis. So this is important for you to understand. So firstly, let's write about pressure and traction epiphysis. Then I will give you the details of atavistic and aberrant epiphysis. So let's write it, pressure epiphysis. So pressure epiphysis, if I talk about pressure epiphysis develops, pressure epiphysis, it develops at the articular end of, at the articulating ends of long bone. It is involved in formation of joint complex. It is also involved in weight transmission. Example. So it is also important for us to know the example. So important examples are head of femur, head of humerus, condyles of femur, condyles of femur. Okay. Now traction epiphysis. So if I talk about traction epiphysis, so please write down traction epiphysis. Traction epiphysis are lying close to pressure epiphysis. So it develops along the line of muscle pull. It develops along the line of muscle pull in non-articulating part of the bone, in non-articulating part of bone. It is found in the non-articulating part of bone. Do not take part in formation of joint complex, Okay. Not involved in weight transmission, not involved in weight transmission. Not involved in weight transmission. Examples of traction epiphysis are greater and lesser tubercle of humerus, greater and lesser tubercle of humerus, greater and lesser tubercle of humerus, greater and lesser trochanter of greater and lesser trochanter of femur. Epicondyles, medial and lateral epicondyles. Medial and lateral epicondyles of femur or humerus, all these. Okay. These are important facts about traction epiphysis. Now we will move on with the next, that is aberrant and atavistic. So now I would like to know what do you mean by aberrant and what do you mean by traction epiphysis. So basically aberrant means deviation from normal. The word aberrant, if I want you to understand what do we mean by the word aberrant, aberrant means deviation from normal. Okay. So deviation from the normal position of epiphysis in case the aberrant location is epiphysis present at the head of first metacarpal. Okay, so they are deviating from normal position and the aberrant location will be present, aberrant epiphysis will be present at the base of other metacarpal. So this is an important point about aberrant epiphysis. Aberrant epiphysis means deviation from the normal. The word aberrant means deviation from the normal. Examples will be, one is this aberrant, one is the aberrant epiphysis present for the head of first metacarpal, aberrant epiphysis present at the head of first metacarpal, and the other is aberrant epiphysis present at the bases of other metacarpal. Okay, now atavistic. Now coming to the next, that is atavistic epiphysis. So if I talk about atavistic epiphysis, actually atavistic epiphysis are the epiphysis, actually these are the parts of the bone. In case of animals they are separate bone, but in case of human beings they are the part of one bone. So we have got two best example of atavistic epiphysis, that is coracoid process of scapula. So this is an scapula bone, and this beak-like projection which you are seeing is the coracoid process of scapula. This is called as coracoid process of scapula. Now here we can see this is the posterior tubercle and this is the coracoid process. So this is coracoid process of scapula and this is the posterior tubercle of talus, that is os trigonum. Okay, we have got os trigonum and posterior tubercle of scapula. These are actually the part of one bone in case of human beings, but in animals they are separate bone. So these two examples are the examples of atavistic epiphysis. These two are the example of atavistic epiphysis. So these atavistic epiphysis are actually separate bone in the lower animals. They are separate bone in lower animals. But in human beings, human skeleton, it fuses with the other bone. That means in humans, like coracoid process is the part of scapula bone and os trigonum is the part of talus bone. Okay. Yes. So done with this. Now let's see more of images of long bones. So here parts of long bones we have already done. I just want you to show that this is the proximal end of the femoral epiphysis. This is the growth plate. This is metaphysis. This is distal femoral epiphysis and this is the growth plate. So whenever there is firstly a growth plate, but then the fusion of the epiphysis and diaphysis takes place, it is in the form of epiphyseal line. So you can see this another image in which you can see the proximal end of proximal epiphysis, distal epiphysis, the metaphysis, diaphysis all has been shown, and you can see the growth plate is in the form of epiphyseal line. So here you can see the growth plate is in the form of epiphyseal line. Okay. So epiphyseal cartilage becomes epiphyseal line. So it is, if I talk about epiphyseal cartilage which is lying at the junction of or ends of the bone close to epiphysis, it is called growth plate, and this is made of hyaline cartilage, which is intervening between exactly the epiphysis and diaphysis part of long bone. So that is important for you to understand. Epiphyseal cartilage in later development becomes, if we talk about epiphyseal cartilage, later it will form epiphyseal line. Epiphyseal cartilage is also called as, if I talk about epiphyseal cartilage, it is also called as in later life epiphyseal lines. And this epiphyseal cartilage, if I talk about this epiphyseal cartilage, it is also called as growth plate. Okay, growth plate. This is actually made, if I talk about the composition of epiphyseal cartilage, it is made of hyaline cartilage. It is made of hyaline cartilage. Okay. And the location is between epiphysis and diaphysis part of long bone. So where it is located, if I talk about this hyaline plate of cartilage, that is epiphyseal cartilage, it is located between the epiphysis and diaphysis part of long bone. Okay. So that is important for you to understand where it is located and what is it made of. So it is made of the hyaline cartilage. That is also very, very important for you to note. Okay. Now one more diagram which I want everybody to note down. Here we can see the structure of long bone. So here again you can see the epiphysis, the metaphysis and diaphysis. So metaphysis, so basically if I talk about the features, epiphysis is the ends of bone, diaphysis is the strongest part of the bone, and metaphysis is the most vascular part of the bone. Inside you can see in the shaft we have got the compact bone, and inside we have got the medullary cavity. And on the ends close to the epiphyseal ends and all, we have got the spongy part of the bone. So compact bone is also cortical bone, which has got solid osseous bone. So when the compact bone means, basically if I talk about compact bone, they are solid bone, which is also called as cortical bone, and solid osseous part of the bone is called as compact bone. So you should be knowing this. Please write down. Compact bone, also called as cortical bone, mainly present in the diaphysis part of the long bone, which contains solid osseous part of bone. Spongy bone, will contains trabeculae, is also called as cancellous bone. Trabecular bone, it is also called, it contains trabeculae, so it is called as trabecular bone or cancellous bone. It is more of spongy or porous bone, and the appearance of spongy part of the bone, when you tease a section or cut the bone, the appearance will be honeycomb appearance. Okay, honeycomb appearance. Okay, now here I want you to show another image where you can see that actually what you will see, actually when we are talking about the metaphysis part of the bone, you can see the natrient artery is going, and actually the blood vessels inside the metaphysis part of the bone is having hairpin bend. So it is actually most vascular part, and this vascular part of the bone, so if I am talking about this vascular part, these are having hairpin bends. As you can see here, these are in this form. Can you see here? I'm just making, it is the capillary loop. So what is it? It is the capillary loop which is lying inside. It is the capillary loop which is lying inside. Okay. So these arrangement is called as hairpin arrangement. Hairpin arrangement of capillaries. Okay, these are hairpin arrangements of capillaries. So actually metaphysis is the active growing zone of the bone, and it is the most vascular region of the bone, and actually impacted emboli, bacteria circulating in the blood get captured in this area because of hairpin bend arrangement of capillaries, and this is the cause which will lead to the formation of osteomyelitis. Okay, so metaphysis is the, so let's write few important points about metaphysis part of long bone. Metaphysis part of long bone is active growing area of bone, active growing area of bone, active growing area of bone, most vascular part. Okay, and the clinical scenario which you have to know about metaphysis part of the long bone is more infected emboli, bacteria circulating in the blood is lodged here. Lodged here means lodged where? Metaphysis. They are impacted or lodged in the metaphysis. So they are impacted, or you can say lodged, they lodges here or they reside here, their blood, they lodged here. Entrapped, you can, other word will be entrapped. They are entrapped in the metaphysis area, and this is the common site for the formation of osteomyelitis. Okay, so this is the reason of formation of osteomyelitis. Done. Now we have done with this. Now we will move on to the next, that is blood supply of long bone. So let's know about the blood supply of long bone. So basically blood supply of long bone can come from multiple sources. Most important one source is the nutrient artery. So I think you must have studied the bones, and you must have seen that in long bones, in the part of the shaft of the bone, there is foramen or hole that is called as nutrient artery or nutrient foramen. Nutrient foramen direction is towards the metaphysis. So if we see the direction of nutrient foramen through which nutrient artery traverses, it is towards the metaphysis. So nutrient artery forms an important source of arterial supply to the long bone, nutrition for the long bone. Other source will be metaphyseal arteries, perosteal arteries, and epiphyseal arteries. So blood supply of long bone comes from following sources. It comes from nutrient artery, it comes from metaphyseal arteries, it comes from perosteal arteries. The other sources, it also comes from epiphyseal arteries. Epiphyseal arteries. Okay. Now, here we can see important arteries traversing. So basically in this, this is a diagram in which you can see blood supply of long bone, where you can see the nutrient artery and vein is traversing through the nutrient foramen. In this diagram, you can see they are traversing through the nutrient foramen, then goes in ascending and descending direction to supply the blood. So they are traversing. So nutrient artery passes through the nutrient foramen and nutrient canal inside the medullary cavity and supplies the bone marrow. So they will give blood supply, arterial supply to the bone marrow and the inner 2/3 part of the compact bone. So this is an important source of arterial supply to the long bone. Okay, so basically metaphyseal arteries are the branches of neighboring systemic arteries form arterial anastomosis and supplies the epiphysis and diaphysis ends of the bone. So epiphyseal arteries are actually branches of arterial anastomosis, and perosteal arteries are mainly the branches of muscular arteries which is giving arterial supply to the outer 1/3 part of compact bone. So major source of arteries, as I have already mentioned, we have got 4 arteries, but we have to also know how they are giving nutrition to the long bone. Okay, so then I will show you an image for here for the nutrient foramen. So basically please see this diagram. Also I want you to show this bony image. Let me just enlarge it. So here the dotted line which you are seeing is the area of nutrient foramen. This is nutrient foramen. and through the nutrient foramen there is nutrient canal, and which artery enters through it? The artery which is entering through it is the nutrient artery. Okay, so nutrient artery will traverse through the nutrient foramen, enter into nutrient canal, and then enter into the medullary cavity, supplies the bone marrow and supplies the inner 2/3 part of the compact bone. So it's important that we should be aware of these arterial supplies. So please write down. I would like to write blood supply. Write down the heading blood supply of long bone. 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 So the blood supply of long bone comes from following source. The first is nutrient artery. The first is nutrient artery. So nutrient artery traverses through nutrient foramen. So it will traverse through nutrient foramen. The nutrient artery will traverse through nutrient foramen. Then it will go into inside the nutrient canal. It will traverse through nutrient canal. Then it will enter into the medullary cavity. Enter the medullary cavity. So it will enter into the medullary cavity. Now it supplies. So what does nutrient artery supply? So nutrient artery supply nutrient artery supplies the nutrient artery supplies the medulla, the marrow, the inside marrow, bone marrow. So it will supply the bone marrow, and the nutrient artery will supply the inner 2/3 part of compact bone. Okay, inner 2/3 part of the compact bone. Inner 2/3 part of the compact bone. Okay, so as my dear students are understanding, please let me know. Okay, okay dear. So if you have got any doubt, please let me know. Okay, sure. Okay, so this is about the nutrient artery. Now moving on to the next, that is metaphyseal artery. The second arterial supply comes from metaphyseal artery. So let's describe the metaphyseal artery also. Oh, coming to the next point. The second arterial supply is via metaphyseal artery. Okay, if I am talking about metaphyseal arteries, these are branches of neighboring systematic arteries. So they are branches of neighboring, systemic artery. They are branches of neighboring systemic arteries, which is forming arterial anastomosis, which will lead to the formation of arterial anastomosis and will give blood supply to epiphysis and diaphysis part of long bone. So it will lead to the formation of arterial anastomosis and will supply, and it will lead to the arterial supply to epiphysis and diaphysis part of long bone. Epiphysis and diaphysis part of long bone. Epiphysis and diaphysis part of long bone. Now coming to, so this was second source of arterial supply. Coming to the third source of arterial supply. So the third source of arterial supply comes from epiphyseal artery. Epiphyseal arteries. So it comes from the source of epiphyseal arteries. Okay. So when I talk about epiphyseal arteries are actually giving arterial supply at the epiphysis part of the bone. and they are branches of arterial anastomosis. They are branches of arterial anastomosis. Okay. Now coming to the fourth source of arterial supply, parosteal artery. Parosteal artery. Now, if I talk about parosteal artery, they are branches of muscular artery. So they are branches of muscular arteries. And what does the parosteal artery does? Parosteal artery supplies outer 1/3 part of the compact bone. Is also, if I talk about inner 2/3 part of compact bone, it is supplied by nutrient artery, but outer part of the compact bone is supplied by parosteal artery. So it supplies outer 1/3 part of compact bone. Okay, outer 1/3 part of compact. Now, so basically done with this. So we have finished with the important parts. Now I want you to know general division or classification of different kinds of the bones. So basically, so we have got different kinds of bones, like we have got long bones, femur, humerus, tibia, fibula, radius, ulna. We have got also flat bones like sternum. We have got irregular bones like vertebrae. We have got sesamoid bone, that is the patella, and we have got short bones like tarsal bones, carpal bones, and we have got miniature short bones like metacarpals and metatarsals. Okay, so I'm just enlarging this so that you can have an idea. So we have got in our body flat bones like sternum. We have got long bones like tibia, fibula, and many other, radius, ulna and all. Sesamoid bones are such kind of bone. For example, here patella has been. So sesamoid bones are the bones which is lying in the muscle tendon they develop. We have got irregular bones like vertebrae. We have also got short bones like the tarsal and carpal bones. We also have got miniature short bones. So please, we also have got miniature short bones, short long bones, you can say short long bones like this also, metatarsal and metacarpals. Okay, now let's see the other types of the bones. So I would also like everybody to just pay attention to these important points. So like there are some other types of bone, like there are sutures in the skull. So in the sutures of the skull, we have a small sutural bones or Wormian bones, and they are very small sized bones which is found in the skull bones, very close to each other. And we will also have flat bones, like we have got bones of the skull, bones parietal, frontal, these frontal bones, parietal bones, temporal, all the bones are flat bones. Okay, we also have got the other like sternum, scapula, blades are also flat bones. We have got long bones like that of the femur, humerus, tibia, fibula. We have got sesamoid bones. They are small bones which are found near the joints, like for example, they are found in hands, they are found in knees, and they are devoid of perosteum. So they are devoid of perosteum, and the largest sesamoid bone in our body is the patella bone, largest sesamoid bone. Then we have got short bones like that of appearance of short bones of the carpal bones and that of the tarsal bones. They are short bones. Okay. Now you can see this image where we can appreciate the diploid vein. Diploid bone. So what is diploid bones? When I'm talking about diploid bone, let me slightly enlarge it. Yeah. Is it okay? Yeah. So when I'm talking about diploid bone, it means in the skull, actually in the skull we have got diploid bone. So in the skull bone there is an outer perosteum layer. So basically in between the compact bone and the inside spongy bone, so in the outer and inner table, in between the outer and inner table of skull bone, we have got diploid bone. So it is located in between outer and inner table of skull bones. Okay, then we have got another kind of bones that is called as that contains para air nasal sinuses inside. So we have got frontal bone which is containing frontal sinus. We will have ethmoid bone containing ethmoidal sinus. We will have ethmoid bone containing ethmoidal air sinuses, maxillary bone containing maxillary air sinuses. We will have, for example, maxillary air sinus is the largest air sinus and commonly infected air sinus, causing the case of sinusitis. Okay, so these are the important aspect of the, so wherever air is trapped inside the bone, they are called as the pneumatic bone. So which type of bone are they? They are called as pneumatic bone. The other kind of bone is the sesamoid bone. So basically we have seen the sesamoid bone and we are knowing the sesamoid bones are not true bones. Why sesamoid bones are not true bones? As they are devoid of periosteum. So they are devoid of periosteum. So they are not true bones. They are devoid of periosteum. Now, sesamoid bones, the largest sesamoid bone in our body is patella bone, and sesamoid bones are growing in and around joints and in the tendons of muscles. So they grows in the tendon of muscles and in and around joint. So they are also very important locations where we find the sesamoid bone. So I would like to show you few images. For example, if I just enlarge this, you can see this image of sesamoid bone, which is grown in the tendon of quadriceps femoris muscle. So you can just see this image where you can see this is the quadriceps femoris muscle tendon. Okay, so in the quadriceps femoris muscle tendon, the largest sesamoid bone of our body, patella. So patella is the bone which is grown in the tendon of quadriceps femoris muscle. It is the largest sesamoid. Patella bone is the largest sesamoid bone, is the largest sesamoid bone of our body. Growth happens, it grows in, where it grows in the tendon of quadriceps femoris muscle. Quadriceps femoris muscle. Okay, done. Now coming to the next bone which I wanted to show. So let me slightly enlarge it. Can you see here? So the red arrow is over another sesamoid bone. So I just want to highlight this bone. So this is a sesamoid bone which is also located in relation with the muscle, that is lateral head of gastrocnemius. So the name of this sesamoid bone is fibula. What is it called as? It is called as fibula. Let me use another color so that you can visualize it nicely. So this sesamoid bone is called as fibula. Okay, this sesamoid bone is called as fibula, which is grown in the lateral head of gastrocnemius muscle. Okay, done. Now, few more sesamoid bone I want you to show. So see this diagram. When you see this diagram, you can see the other sesamoid bone in this diagram, which is shown in the, so you can see this sesamoid bone which is shown in the medial side. As you can see here, how we are knowing it is medial side. This is the radius bone, so it will be the lateral part, and this is the ulnar bone, so it will be the medial part. And here this sesamoid bone, if you are seeing this sesamoid bone, this sesamoid bone is the red color sesamoid bone, which is the pisiform bone. So this is the pisiform carpal bone. This is pisiform carpal bone. This is pisiform carpal bone, and this pisiform carpal bones is arising. It arises in the tendon of flexor carpi ulnaris. So it is formed in the tendon of FCU muscle. And what is FCU muscle? Flexor carpi ulnaris. FCU muscle, the full form is flexor carpi ulnaris muscle. Okay, flexor carpi ulnaris muscle. Few more location of sesamoid bone. For example, these are two small sesamoid bone, and these two small sesamoid bone, you can see it is growing in relation to the tendon of peroneus longus muscle. Also, you can see these are two small sesamoid bone which is grown in the tendon of the muscle, that is flexor hallucis brevis. So these two sesamoid bones is growing in the tendon of flexor hallucis brevis muscle. Flexor hallucis brevis muscle. Okay, now Few more sesamoid bones are shown in the finger. So we will have many locations of the sesamoid bone. So we can see the different location of sesamoid bone in this image, in this radiological image. So 99 to 100% sesamoid bone is growing in relation with the metacarpophalangeal joint. It is also present in interphalangeal joint of the thumb. It is present in metacarpophalangeal joint of third, fourth, and also so many of this location of sesamoid bone in the hand has been shown. Now, basically, I would also like to tell that embryologically, I want to show you an image. So, embryologically, if I talk about the development of bone, it happens in embryologically, the bones derived can go ossification, and the bones can be categorized as the intramembranous and enchondral ossification. So, embryologically, that means developmentally, the bones can be classified as two types of bones. One is intramembranous bones. The other is enchondral bones. Enchondral bones. Now, here actually there are two types of ossification. One is the intramembranous ossification, in which the bones are formed directly from the undifferentiated mesenchyme. So in this category, the bones develop from undifferentiated mesenchyme, and in the enchondral ossification type, the bones will be formed from the cartilage model. So firstly, the cartilage is formed and then the bone is formed. In the case of intramembranous ossification, the bones are formed from the mesoderm directly. Okay. Now, bone developing. So let's talk about the development of bones. So when now we talk about the bones being developed, so the bones are developing from the mesodermal condensation. They are called as intramembranous ossification and formation of the bone. So write down bones developing directly from mesodermal condensation, that is from undifferentiated mesenchyme, such kind of bone is called as intramembranous. Such kind of bone is undergoing intramembranous ossification. And the example of such bones, so basically example, so if I talk about the bones which is going in this kind of ossification, this kind of formation is the parietal bone, facial bones, and the part of mandible and clavicle. So basically bones of skull like parietal bones, the face bones, the mandible and clavicle. Okay. Now actually the other type of bones, which is the cartilage model. So we also have enchondral ossification and bone formation. So let's see there. Bones developing via cartilage model. So actually most of the bones in our body, bones of upper limb, lower, most bones in our body or long bones are generally following the cartilage model. Examples will be long bones. Example, no need to write because many long bones are there, all these examples. But I would like to tell few bones in our body is following both the formation, intramembranous ossification and enchondral ossification. So both bones formed via both intramembranous ossification, both via intramembranous and enchondral ossification endochondral ossification are so we have got these bones which follow both. So we will have, so these bones are occipital bone, we will have occipital bone, mandible bone, we will have temporal bone, sphenoid bone, clavicle. Okay. So these are the bones which is forming both enchondral and intramembranous ossification. Now let's talk about ossification. So basically, if I talk about ossification, so we have got primary ossification centers and secondary ossification centers. So primary ossification centers appears in the shaft part of the long bone, okay, in the shaft part of the diaphysis part of the long bone before birth, and generally secondary ossification appears after birth in the ends of long bone, okay, upper or lower ends of the long bone. Okay, so basically always remember, if I am talking about before birth, primary ossification appears. So generally 7 to 8 week of 8 to 9 or 7 to 8 week of intrauterine life, these appears, and secondary ossification appears after birth. Now there is also a law of ossification regarding these important points. So basically, actually the epiphyseals, so we are there is no doubt about primary ossification centers, but secondary ossification is forming at the ends of bones. That means there will be an upper and lower end. So the epiphyseal center which appears first will fuse first with the diaphysis, and the epiphyseal center which appears later will fuse first. So this is an important. So how you can remember this? Any doubt, please let me know, my dear students. So basically how you are going to remember this can be remembered like for example, the student who come to the class early leaves the class late, but the student who enter the class late, they will leave the class early. So this is the law of ossification. So that is, please write down this important point. The epiphyseal center, the secondary epiphysis center, the secondary epiphyseal center which appear first unites last with diaphysis, unite last with the diaphysis. Okay, and the one that appears last fuses first. That appears last fuses first. Okay. Now here you can see another diagram in which you can see the direction of nutrient foramen. So direction of nutrient, and you can see this is one nutrient foramen, this is another. Nutrient foramens are actually directed towards the metaphysis. So their direction will be towards the metaphysis, nutrient foramen. And I want you to know that you are definitely knowing that nutrient foramen through is if I talk about the nutrient foramen goes. So if I am talking about the nutrient foramen, it is passing towards the metaphysis, and it is also important for you to know the direction of nutrient foramen, because the growing end of the bone is opposite to the direction of nutrient foramen. So this is very, very important for you to understand. Okay, I would like this is important. Nutrient foramen, please write on this important point. Nutrient foramen direct away from the growing end. They are directed away from the growing end of long bone. Growing end of long bone. Okay. Their direction is, nutrient foramen directs away from the growing end of the long bone. So basically that is very important. So the key point is, actually, if you will see the direction of nutrient foramen, so it is directed. If I talk about nutrient foramen, its direction is very important for you to understand. So you can see here, this is exactly the direction. So this is exactly the direction. It is actually direction of, this image is showing you the direction of nutrient foramen. Direction of nutrient foramen. Okay, this image is showing you the direction of nutrient foramen, and you can see the direction of nutrient foramen is towards the elbow and away from the knee. So this is the direction of nutrient foramen. So the growing end of the bone will be just opposite to the direction of nutrient foramen. This is important. Okay. And the direction of nutrient foramen is towards the metaphysis. This is also important for you, that it is towards the metaphysis. Now, generally, I would like to show you this image where you can see the bone. Cut section of the bone has been shown. This is an outer compact bone part. This is an outer compact bone part which has been shown. And here we can see the spongy part of the bone. This is the bone matrix and this is the osteo. Okay, this is the osteo. So you have to also understand that that what all the important structures are lying in the bone. That is very, very important for you to understand. So as I have told you, the ends of the bones are, if I talk about ends of the bone, it is actually having epiphysis. The middle part of the bone is diaphysis, and it is important that you should be quite aware of which is the important area. And here the cut section of the bone has been shown, in which you can see the spongy and compact bone. So basically, actually this also, when we see the compact bone section in the histology, then it becomes easy for us. So in that case, it becomes easy for us to understand the important area. So that is very, very important for you to understand. Okay. Now, okay. So basically, if you're, so everyone, is it okay? Here, can you understand direction of nutrient foramen has been written. So I just want you to go through this. So my dear student, any doubt you can ask me. So what will be the direction of nutrient foramen? So the mnemonic is to the elbow I go, and from the knee I flee. So this is the mnemonic direction of nutrient foramen which is shown. So to the elbow I go, and from the knee I flee. The other is, so that means growing end of the bone. So that means growing end of the bone will be opposite to the direction of nutrient foramen. So in the upper limb, the growing end of the bone will be. So my dear student, can anybody give me the answer? So that means in the upper limb, the growing end of the bone will be. What will be the growing end of the bone? In the upper limb, the growing end of the bone will be shoulders and the wrist. Okay, shoulders and wrist. And in the lower limb, the growing end of the bone will be around the knee. So in lower limb, the growing end of the bone will be around the knee. Okay, got it? This is an important point. Also, I already told you law of ossification. That was very important. And I also told you, generally the primary center of ossification appears by 6 to 8 weeks of intrauterine life. And basically there is an exception to this law also. Primary center of ossification appears in the diaphysis part of the bone before birth, and secondary center appears after birth. So that is also important point. So law of ossification, which I have told you. So here, if you want, you can write one important point. So which bone is voiding? So primary ossification center. I told you primary ossification centers appear before birth. That is generally what happens. Primary center of ossification appears before birth. So approximately 6 to 8 weeks of intrauterine life. Except, why I am writing this, there are some bones which is not following this law. So there are some bones like cuneiform bones of the tarsal bone and the navicular bone. So this law is not followed by cuneiform bones and navicular bones of the foot. This law is not followed by cuneiform bones. This is important for MCQs also and for your Viva question also. The bones which is not forming the law. Okay, that is cuneiform and navicular bone. Same way, if I talk about secondary centers, they appear after birth and with the following exception, except the lower end of. So one more point is important about secondary ossification center. So please write down, this is also important for Viva or MCQ. Secondary ossification center appears, secondary ossification center appears after birth, except lower end of femur, and upper end of tibia. upper end of tibia and upper end of tibia, except lower end of femur and upper end of tibia. These are important points. Okay. Now, law of ossification is that the secondary is, so this is law of ossification center, which I have explained you. Secondary center of ossification, which appears first, which will unite later, and which appears late will unite first. Okay. But there is an exception to this law. So there is also an exception. There is also an exception to this law of ossification in case of which bone? Fibula. So fibula bone is not following this law. Okay. That you have to know. So here distal end of epiphysis appear first and unites first. So this is not, this is also violating the law. Distal end of epiphysis, distal end, that means distal epiphysis appears first and unites first. Unite first. That is important for you to understand. Okay, the reason is that actually distal end, why the reason is that? Because distal end is a type of pressure epiphysis. So always pressure epiphysis unites first. So that is the reason. Okay, so that is the reason. So we have done with this. Let me just show you few images. Okay, so done with this now. Okay, few more things I want you to tell. Actually, this all things will be studied in much more detail when we will study the histology part. But here, the section of compact bone has been done so that you get an idea what lies inside. So here you can see, obviously, if I just enlarge this image, you can have an idea. Here periosteum has been cut. See here, in this diagram, you can see the periosteum has been cut. And the periosteum is showing outer fibrous and inner cellular layer. There is osteocytes which is residing in the lacuna, and this osteocytes is having cytoplasmic processes which is called as canaliculi, which is forming attachment from one osteocyte to other. The osteocytes are residing in the space lacunae, and this is actually the inner lining of the bone is endosteum and the outer is osteoclast. We have got different kinds of cells: osteogenic cells, osteoclast cells, osteoblast cells, osteocyte cells. These are the different cells of the bones. Okay, now here in the periosteum part, I just want you to show this image, because when I am talking about periosteum, you already know the outer covering of the bone is called as periosteum, which will have an outer fibrous layer and which will have an inner chondrogenic layer. Now, periosteum is absent where? We know that periosteum is absent in articular surface, articular variety of cartilage, sesamoid bone, and also in the fibrocartilage. So, one more example. It is also absent in fibrocartilage. And you already know it is made of two layer, outer fibrous, inner cellular. Now, I just want you to give a concept of Sarple fibers or extrinsic fibers. So, the other name is, they are also called as bone fibers. They are also called as bone fibers. So, in this diagram, you can see bone fibers or the extrinsic fibers or Sarple fibers. They are the fibers which is arising. So, this is the fibrous, and this is actually the periosteum layer. So, from the periosteum layer, the fibrous layers are going inside the bone. So, they are going inside the bone. So, they are also called as anchoring fibers. So, what is their function? They are actually also called as anchoring fibers. They are giving support to the bone. So, why they are important? Because they are giving support to the bones. Okay. So, they are also called as bone fibers. They are also called as anchoring fibers, and they are giving support to the bone, as you can see. So, it is referred as the bone fibers, perforating fibers, Sarple fibers, and they are actually present in, they are forming a connection, and they are primarily predominantly consist of strong type 1 collagen fibers. So if I talk about this Sarple fibers, they are actually fibers are they are matrix of connective tissue which is consist of collagen fibers type 1 connecting periosteum and the bone. So in other words, you can define as a note point, please write down. They are matrix of connective tissue consisting of type 1 collagen fibers connecting periosteum and the bone. Connecting, what is its function? So they are very important. The function of this sarple fibers are very important. Why? Because they are forming a connecting link between the perosteum and the bone inside. So they are connecting the bone and perosteum inside. So here this is the perosteum, my dear students, and this is the perosteum. So if you want, we can use another color. Okay, so this is the perosteum which you are seeing, and this perosteum is connected by this sarple fibers to the bone inside. So this is bone, and obviously this is the bone. What you are seeing, these are lacunae. What are these? These are lacunae, and these lacunae will contain osteocytes inside. They contain osteocytes inside. Okay, and the osteocytes lacunae will communicate each other with the canaliculi. Now here also you can see the cut section at the endosteum, which is lying inside. It is a thin membrane of vascular connective tissue. What is its composition? It is consist of vascular connective tissue lining the medullary cavity of long bone and in the marrow space, as you can see in the cancellous part of the bone. Okay, so when we will study also, when we will actually study the details of bones, cartilages in the class, and in the histology part, I will give you a detailed composition and detailed images so that you can understand the histological aspect and details of compact bone, cancellous bone. So here just I am giving you a brief about the general aspect or general anatomy part of the bone. So here we can see the structure of compact bone. Here we can see the cut section of the compact bone. Transverse section has been shown to you, where you can see there is a center. Can you see? In there is a center which is called as Haversian canal. So actually this is called an Haversian canal. If you want, I can just enlarge it. So you can see the long bone is section. It's the cut. The section has been taken from the long bone. As you can see, it is cut. And when it is cut, you can see here that this section inside will have an Haversian canal. So what is this called as Haversian canal? This part is called as Haversian canal. This Haversian canal is surrounded by concentric laminas. So these are surrounded by concentric laminas, and these concentric laminas are containing osteocytes in the lacunae. As you can see, these are osteocytes which is lying in the lacunae, and these cytoplasmic projections are canaliculi which is connecting the osteocyte. So this whole one unit which is containing Haversian canal in the center, through which nerves and vessels are traversing, this whole unit which you are seeing is called as osteon or Haversian system. So what is it called as? It is called an osteon, or the other name given to it is Haversian system. Okay, now one canaliculi also if I talk about this canaliculi, this is forming connection between each another and forming connection with the cells that is osteocytes. Now here what you can see, if we are talking about Haversian canal, so we can see that these are the Haversian canals, and one Haversian canal is connected by the other Haversian canal by the Volkmann canal. So this connecting canal will be called as Volkmann canal. Okay, so it is important for you to know what is Volkmann canal, what is Haversian canal, and how it is connecting with each other. So when you see the section, so on of the compact bone, you can see the Haversian system, also called as osteon. You can see the circumferential laminae. You can see the concentric laminae. So there is 9 to 20 concentric lamina. In that concentric lamina, we have got the osteocytes located in the space called lacunae, and the osteocytes will have canaliculi as a projection cytoplasmic process which will form attachment with each other of the other osteocytes. And outer aspect, you can see in the outer aspect, you can see the perosteum which is made of fibrous and that of chondrogenic layer. So this is the perosteum having fibrous and chondrogenic layer. So all these points are important for the compact bone. Now we have done with this. Now I want you to solve few MCQs with me. Okay, let's solve. So we have now, my dear students, we have completed the bone in much more detail. We have completed the cartilage and bones general anatomy, general aspect. Now I want that everyone should solve few MCQs along with me. Okay, let's solve together. Okay, question number 1. Hyaline cartilage is found in Option A, bronchus, alveoli, alveolar duct, terminal bronchus, respiratory bronchial. Hyaline cartilage. So I have already given you the example of hyaline cartilage and I have told you where it is present. So can you mark the right answer? Hyaline cartilage is found at which of the following location? Everyone, so yes, we know hyaline cartilage of costal variety, it is found in the principal bronchus. So it is found in trachea and principal bronchus and costal cartilages, anterior aspect of the ribs. So best answer is the bronchus. Okay, done. Let's move on to the next question. Question number 2. Mastoid process is which type of epiphysis? Whether it is pressure, aberrant, atavistic or traction epiphysis. So mastoid process means the mastoid process of temporal bone. So if I am talking about mastoid process of temporal bone, it is not taking part in formation of joint complex. It is actually those ends of the bone which is forming joint complex take part in the weight transmission are pressure epiphysis. Traction epiphysis are those part of the bone where we have the attachment of tendons, ligament and traction of the muscle pull it is formed. So the right answer is the traction epiphysis. So not pressure because not forming the joint. Aberrant is abnormal location that is present in the head of first metacarpal and the bases of other metacarpal. Atavistic, we have got just two examples, coracoid process and ostrigonum. Coracoid process of scapula and ostrigonum of the talus which we have seen. So the correct answer is traction epiphysis. Now moving on to the next question. Pisiform bone. Pisiform bone is in which type of bone? So pisiform bone type is whether it is pneumatic bone containing air inside, whether it is sesamoid bone. When I am use the word sesamoid bone, that means it is formed in the tendon of some muscle, accessory bones or long bones. So definitely we know pisiform is a carpal bone and I have already told it is devoid of periosteum and it is found in the tendon of flexor carpi ulnaris muscle. So the right answer is it is sesamoid bone. Okay, now coming to the next question, nutrient artery runs in which of the following direction? So nutrient artery runs towards metaphysis, away from the metaphysis, away from epiphysis or none of the above. So if I talk about the direction of nutrient foramen, obviously it is running towards epiphysis. So towards, it is running towards metaphysis. So the correct answer is nutrient artery runs towards metaphysis, not away from the epiphysis, not away from metaphysis. The direction, I have already told you, the direction of nutrient artery is towards metaphysis and opposite to the direction of nutrient artery is the growing end of the bone. Is it okay? Okay. Now, which of the following is an aberrant epiphysis? Whether aberrant means abnormal location, not normal location of epiphysis, whether it is present in coracoid epiphysis, greater tubercle, base of first metacarpal or base of second metacarpal. So my dear students, I have already told you, actually coracoid epiphysis is not right because it is the type of atavistic epiphysis. Greater tubercle is an important traction epiphysis. Base of first metacarpal is wrong. It should be head of first metacarpal. The correct answer is base of second metacarpal, which is the example of aberrant epiphysis. Now coming to the next. So this is an image-based question. This is an image-based question. Identify the histological slide. Whether it is fibro, whether it is elastic, whether it is hyaline or none of the above. So here in this image, you can see these are chondrocytes. These are chondrocytes and the number of chondrocytes are scanty. So we have got chondrocytes, but the number of chondrocytes are scanty. But scanty number is there. Scanty number of chondrocytes are there and the slide is not having and the histological slide is devoid of perichondrium. So it is not having perichondrium also. It is not having perichondrium. Perichondrium is not present, absent. So it becomes a slide of fibrocartilage and you can see on the slide, on the histological slide, you can see the appearance is feathery pink, more of collagen, so many collagen, so bundles of collagen fibers are there. So here we can see collagen fibers bundle, which is giving wavy appearance, wavy appearance. So wavy appearance is there for the collagen bundle and type 1 collagen fibers are present. Which type of collagen fibers are present? We have got type 1 variety of collagen fibers. We have got type 1 variety of collagen fibers. The right answer is fibrocartilage. What is this? The right answer is fibrocartilage. Okay. Done. Now let's move. So here also you can see the enlarged view where we can see the nuclei of chondrocyte, collagen fibers, wavy, We can see row of chondrocytes and collagen fibers, type 1 collagen fibers are there. Now moving on to the next question, that is question number 7. Identify the histological slide, whether it is the slide of fibrocartilage, whether it is a slide of hyaline cartilage, elastic or articular cartilage. So I just want to enlarge this image where you can see large number. What you can see there is actually this slide is having multiple chondrocytes, dense chondrocytes, and in between, if you will see, okay, I just know I want you to concentrate on this image. So you can see the in between there are collagen, in between there are elastic fibers, sorry. In between the branching patterns of elastic fibers will be there, large number of elastic fibers and so many chondrocytes which are dense and they are lying compact each other, and they are very dense and large number of chondrocytes are there. This is brightly stained slide which is also having, so just see here, this is also having the presence of perichondrium. Perichondrium is present, which is consist of fibrous. So this is F for fibrous layer and this is C for chondrogenic layer. So this becomes a slide of, so what will be the right answer? This becomes a slide of elastic cartilage. Okay, now moving to the next question, that all of the following, so in next question, all of the following are examples of traction epiphysis. So all of the following are example of traction epiphysis except, so actually traction epiphysis, you know that it will be formed by the pull of muscles, tendon, ligaments. So basically it is lying near the pressure epiphysis, but it is not taking part in formation of joint complex and not involved in weight transmission. So traction epiphysis, so basically if I am talking about greater trochanter, yes, definitely it is an example of traction epiphysis. Okay, it is an example of traction epiphysis, no doubt about this. Now, if I talk about lesser trochanter, it is also an example of traction epiphysis, no doubt about this. Mastoid process, I told you, it is also having pull of muscles attached here. So it is also an example of traction epiphysis. My dear, the right answer is deltoid tuberosity. Where is the deltoid tuberosity present? So if you will see, this is the deltoid muscle and this deltoid muscle is inserting in the humerus middle part. Though this is deltoid muscle. This is the deltoid muscle and it is inserting somewhere in the middle of the humerus and the deltoid tuberosity. So basically deltoid tuberosity is the part which will be present in the shaft of humerus, and that means its shaft is the diaphysis part of the bone. So deltoid tuberosity is not an example of epiphysis. It is the diaphysis part of the bone. It is diaphysis part of the bone. So deltoid tuberosity is not epiphysis. So it is not a traction epiphysis. So the correct answer is deltoid tuberosity. So got it? Two ways to solve this MCQ, either strike out the other option, or if you are knowing deltoid tuberosity, deltoid muscle inserting in the humerus bone middle part in the shaft part. So definitely D is the right answer. So yes, my dear students, we have finished with this session. I hope the session is useful for you. Please go through this topic. This is very important. If I want to summarize that things which will be very important for your university papers, practical and viva examination is the types of epiphysis along with the example, differentiating features of different types of cartilage, hyaline cartilage, fibrocartilage, elastic cartilage, how you will differentiate the features of articular and the costal variety of hyaline cartilage. You have to know the example of each variety of cartilage where it is present, differentiating feature, histological appearance also. You have to also know the details of the parts of long bone. You have to know the arteries supplying the long bones. You have to know the law of ossification, the bone which is not following the law of ossification. You have to know the bones which is not following the law of primary center of ossification, secondary center of ossification. So we have done this topic in much detail. I want everybody to go through this. This is a very important topic in which you have to know about the different areas of the bone, different parts of the bone, what is the reason that metaphysis is the common site of osteomyelitis. All these clinical aspect also will be asked in the viva examination. For enumeration, examples, differentiating features of cartilages can be asked, type of epiphysis along with that examples will be asked. Okay, so this is a very important topic, and all the best and keep studying. Again, I will have a session not tomorrow, day after tomorrow at the same time, 6:30 p.m. we will meet for the topic of muscles. Okay, thank you so much. All the best and keep studying. Thank you, my dear students. Thank you.